back from 2001 through 2006, we saw healthcare costs and premiums increase by about 63% during that period. And then as we got from 2006 through 2011, we saw them increase by another 31%. And the whole point was that healthcare costs were far outpacing cost of living. Over this period of time, and in the 90s as well, we saw employer plans become less available, which is really a national phenomenon that we saw along with benefits that a lot of employers used to provide. Millions of Americans were unable to afford health insurance if the plans weren't provided by their employers. And people with pre-existing conditions were unable to find health insurance. The uninsured health costs to hospitals, doctors, and other healthcare providers rose drastically since no one can be denied care in the emergency room. And so many people who didn't have health insurance would still go to the emergency room, and that would raise costs for all these different healthcare providers. And of course, the concern was it got passed on to the employer plans and also to the taxpayers. In 2011, Congress and President Barack Obama passed the Patient Protection and Affordable Care Act to resolve the healthcare crisis. And just so we're very clear, Obamacare is the Affordable Care Act and vice versa. Seems like a fact that we may not need to mention, but I think people need to understand it's the same thing. I want to go through some of the basic protections and coverage requirements under the Act. First, it protects all Americans from health plan discrimination based upon pre-existing conditions, including gender and other health conditions. It allows young people, all young people in America, to stay on their parents' plans up to age 26. It protects all Americans from going bankrupt when they get sick by barring lifetime caps. It requires health insurance companies to spend at least 80% of the revenue on providing health care. It requires businesses with over 30 employees to provide health insurance to those who work over 30 hours a week. And it gives these businesses tax credits to pay for these requirements. That's the basis of the major protections. Of course, there are others, but those are the big ones that you'll see. The second thing it does is creates healthcare exchanges. This is a fancy way to describe a healthcare website to shop for private healthcare plans called healthcare.gov. Private plans. Obamacare is not a government plan. It's a website that provides private plans, and that's one of the common misconceptions. Each state had the option for a state exchange or a federal exchange. I got to sit on the Patient Protection and Affordable Care Act special committee in the Senate, and we decided for Florida it was right to have a federal exchange. I didn't know at the time when I cast that vote that we'd become the largest federal exchange in the nation. There is no larger federal exchange than Florida. The exchange website provides for different plan options labeled by color: bronze, silver, gold, and platinum. Bronze has the lowest monthly payments but the highest out-of-pocket expenses, otherwise known as deductibles. Silver and gold are in the middle, and platinum has the highest monthly payments but the lowest out-of-pocket expenses. So, in short, you get what you pay for. Major medical plans, which cover only major health care expenses with large deductibles, are available if you meet certain hardship criteria. But the trend has been to get away from those if possible. It provides for subsidies and tax credits. We continue to provide Medicaid to those who are below the poverty line. Just to give you an idea of numbers, that's $11,880 for an individual. And for a family of four, it's about $24,300. So you get a sense of what we're talking about as far as income. Americans between 100 and 400% of the poverty level get tax credits. So above that $11,880 for an individual, above that $24,300 for a family of four. Americans who fall within the 100 to 250,000, or 100% to 250% of federal poverty level get out-of-pocket cost assistance. This is how we make health insurance more affordable, is by providing these subsidies and tax credits. Many of you have heard about the Medicaid gap, and it was anticipated when they developed the plan that those who fell between 100% of the federal poverty level and 138% of the federal poverty level would still have great difficulty being able to afford plans. This is the infamous Medicaid gap that you've heard so much about. Just to give you an idea for Florida, over 800,000 Floridians fall into this gap. So they do not get coverage currently because, as you know, Florida has chosen not to expand Medicaid, something that we pushed heavily for when I was in the Florida Senate. States initially were instructed to expand Medicaid under the Act, but the Supreme Court ruled that the federal government couldn't force them, so it became optional. We have 31 states that have expanded Medicaid to those between 100% and 138% of the federal poverty line, and then another 19 states chose not to. So a majority of the states have actually expanded Medicaid, including states of all different political spectrums. The federal government paid for 100% of this expansion up until 2020, and then 90% after that. So in 2020, a lot of states would start to have skin in the game. How do we fund the ACA? Often a big question. First, there is the individual mandate that many of you have heard about. It's a penalty of $695 per adult, or 2.5% of income, whichever is greater, for anyone who chooses not to have health insurance. And this is an idea that started actually back during the days when President Bill Clinton put forward a health care plan. And it was actually an idea by Senator Hatch and others to create accountability, because the big question is, anybody could go into the emergency room, so we can't stop them, so we as taxpayers are on the hook, but there's no accountability to require people to pay for that. And so, again, $695 penalty per adult, 2.5%. There's also what's known as the Cadillac tax, which is an annual 40% excise tax on plans with annual premiums exceeding $10,200 for individuals or $27,500 for a family starting in 2018. These are these more robust plans that many folks who are in corporate America and are getting health insurance through their unions even are affected by, and that's something that we're currently debating in Congress. Then there's the medical device tax, which is 2.3% on medical device, 2.3% medical excise tax that manufacturers and importers started paying on January 1st, 2013. Other funding sources include tax increases to high-wage earners and their investment income, annual fees for health provider and drug manufacturers and importers, adjustments to medical expense deductions, Medicare tax rate adjustment, and even a tax on indoor tanning services. All of these that I just mentioned, other than the tax on robust plans, have already been in place. So we already have those taxes in place. The results. Over 20 million more people in the United States have health insurance as a result of the ACA. 11.5 million of them signed up for the exchanges. It reduced the national uninsured rate from 18% to 11.4%, which is a nearly 7% reduction nationwide. A Kaiser study that just came out shows that the average family premiums rose, as we talked about before, 63% from 2001 to 2006. 31% more from 2006 to 2011. So we saw double digits each over the course of years. But then by a lower percent of 20% from 2011 to 2016 after the ACA. So still not amazing. 20% is still a lot, but it bent the curve. Florida by the numbers. This is where it is most important when we look at our state. 1.8, I know there was 1.6 on there, but that's actually from the 2015 numbers. The current numbers are 1.8 million Floridians signed up for the Obamacare plans, which represents the largest federal exchange in the nation. We have $5.2 billion in subsidies, which is more than any other state. So you see Florida has two big outlier positions. One is that we have the largest federal exchange. Two is we get more federal subsidies than any other state, including larger states of Texas and California. There's been a 38% reduction in uninsured rate in Florida. And one of the big reasons for that is we don't have as many folks who are on employer insurance plans in Florida as opposed to other states. And so it filled a bigger need in states like Florida, Texas, and California, where there wasn't as many employer health insurance plans. But there's no doubt the act is not perfect and changes need to be made. And the same thing was true when Social Security was passed, Medicare and Medicaid. and we're still trying to mend those. And so we're